Guys, welcome back to my channel. If you're new here, please hit the subscribe button, like, comment, share. So today we're talking about the diagnosis of male infertility. Diagnosis of male infertility. Evaluation usually begins with a detailed medical history. And again a detailed physical examination of this individual. The most important test that will be needed or that is always done is the semen analysis. Semen analysis. Here, you look out for sperm count, the sperm morphology, and the sperm motility. And again, you also do microscopic culture and sensitivity. Other medical investigations include hormonal tests, scrotal ultrasound. You can also do genetic tests, testicular biopsy, etc. This test helps to identify the underlying cause, and it also helps in guiding you to know the treatment regimen that will be needed for a particular individual. Here, treatments include medical treatment and surgical treatment. If infertility is caused by an infection, that is where the microscopic culture and sensitivity comes in. If it is a bacterial infection, you can take care of it, and antibiotics might be prescribed by a doctor. And here, hormonal abnormalities will be tackled with hormonal therapy, and erectile dysfunctions, certain conditions like ejaculation disorders will also be taken care of medically. Here we also have surgical treatment, which includes varicocelectomy to repair varicocele, and again vasectomy reversal. Here, surgical removal of reproductive tract obstructions are being done also. Someone might say, do they do surgical removal of obstructions? Is there things like obstruction in the reproductive tract? Yes. Certain obstructions can cause a certain level of infertility in a man. In a case where both the medical and the surgical treatment did not work out, here we can go with assisted reproductive techniques. If other treatments are unsuccessful, like I said, assisted reproductive technologies can help the couple to conceive. Common methods include intrauterine insemination, that is the IUI. And then here, sperm are placed directly in the uterus. In the case of IUI, the sperm are being placed directly in the uterus. And then you can also go for in vitro fertilization, that is the IVF. In vitro fertilization, the IVF. Here, eggs are fertilized with sperm in the laboratory. In the IVF form case or situation, the eggs are being fertilized in the laboratory, while in IUI, here the sperm is placed directly in the uterus. You get? Good. And then there are these other kinds of technologies that you use in achieving pregnancy. That is the ICSI. That is the intracytoplasmic sperm injection. A single sperm is injected directly into the egg. So here, this technique have significantly, improved pregnancy outcomes for infertile couples. Don't say, oh, I've tried my best, there is nothing coming out of it, go and kill myself. My friends, my neighbors, they all have kids. I'm the only one that doesn't have a child. Let me go and die. Let me go and commit suicide because of having a child. No, there is always a solution. Here, these assisted technologies will help you to achieve pregnancy. And again, you know that whether you carried the child in your womb or it was fertilized outside, or even adoption is one of the ways where you can have your own child. So do not say because you didn't achieve pregnancy this way they used to do it, it's abnormal. No, it is never abnormal. So when it comes to certain things that you can do to improve your fertility, or certain things you need to stop in order to improve your fertility, that is when we get into prevention and lifestyle advice. So men can improve fertility by adopting healthy habits. There are some healthy habits you can adopt in order to improve your fertility as a man, such as avoid smoking and drugs. You need to avoid smoking. See, smoking, it is not good for your fertility. You need to reduce alcohol consumption. Maybe you used to consume, like, let's say 10 bottles. You have to bring it down. Like, keep bringing it down to at least 1 bottle. Then you have to maintain a healthy weight. Obesity is one of the causes of infertility. In fact, obesity is not good at all. So please, even if you're on the fat side, on the big side, you try as much as possible to curtail what you eat, you exercise in order to reduce. Maintain a healthy weight. Avoid excessive heat exposure to your testes. Hey guys, welcome back to my channel. In summary, male infertility is a common medical condition. Like I said, it is not something that you will start panicking. It is not something that will make you to have sleepless nights. I know most times people tend to have sleepless nights because of male infertility, but I mean, it is not necessary. So with multiple cases, including sperm production problems, obstruction, hormonal imbalance, and lifestyle factors. Fortunately, many cases are treatable with medical therapy, medical or assisted reproduction, reproductive techniques or technology. If a couple is unable to conceive after 1 year, in summary, male infertility is a common medical condition. Like it is not something that will come and start giving you sleepless nights. You will start thinking of how to do yourself, or you start thinking that, oh, you're less of a man. No. Male infertility is a common medical condition. It is not something that will start giving you sleepless nights. You start thinking of, oh, you're less of a man, you're not man enough to get your wife pregnant. No. It is not something that should give you sleepless nights. You start thinking of, killing yourself. It is not worth it. With multiple cases of sperm production issues or problems, obstruction, hormonal imbalance, and lifestyle factors. I mean, fortunately, most cases are treatable with medical therapy, surgical or assisted reproductive technique or technology. So if a couple, they are unable to conceive after 1 year, 2 years, or thereabouts, partners should just undergo medical evaluation. Like, go and know the particular reason why you're not getting pregnant. Check out what the problem is, know how to tackle it. If it is something that you can that is a medical issue, you can seek medical attention. If it's a surgical treatment that will be needed, and you'll be fine. Then if the both of you, or you as a man, is not able to, maybe it is a case of impotency, I mean, you can go for assisted reproductive techniques. Thank you for watching. Please like, share, and subscribe for more medical educational videos. Thank you.